Thank you, Dr. Martin Muturi, for joining this discussion. I would like to know from you, from the Kenyan experience, what has been the most critical success factor in operationalizing One Health in Kenya?
Thank you, Lillian, for the opportunity to talk to me. I would sum it up quite easily. For us, it has been government ownership. Government owning the process, leading the process, and being an integral part of all the daily work we do has really contributed to the success of the One Health Office in Kenya. Simply put, is when you have the government owning the process of One Health and being an integral part of it, it really helps push the agenda and make it sustainable. So for us, that has been one of our main success factors, of course, besides other issues that support our work in Kenya.
Mm-hmm. And when you say government owns the process or has completely bought into it, could you tell us a bit how the One Health aspects are organized in Kenya?
So the One Health structure in Kenya is a bit unique, I must say, because One Health Office is structured within the ministry system as opposed to a higher up office like is common with other countries. And what I mean is our structure fits within the Ministry of Health and Ministry of Agriculture, and we directly report to the leadership of the two ministries, as opposed to being an entity outside the two ministries. I think this has worked well for us because the Ministry of Health sees the One Health Office as an integral part of its system, an integral part of its organogram, and the same happens for the Ministry of Agriculture and for other partners we work with in government, because it's a peer-to-peer relationship. This has really helped, and it's testament to the fact that in the Ministry of Health, for example, the zoonotic disease unit is one of the divisions very high up, and it's also being elevated in the Ministry of Agriculture to a higher up level from a unit. So I think that's clear testament of the fact that the government really does own the office and it sees it as its own, as opposed to a project or a program of sorts.
Thank you. And would you have experienced any particular challenges that have hindered or that have impeded the operationalization of One Health in Kenya? Could you please describe those and how you perhaps are mitigating those challenges?
Okay, yes, we do face challenges. It's not, we do face some issues here and there. I think the primary one would be, of course, resources. We know in sub-Saharan Africa, resources are limited. We have many other competing health interests. For example, we have what we call the big three. We have a lot of issues around malaria, tuberculosis, HIV. And so advocating for funding for One Health issues where we're dealing with diseases where there's not a lot of data to really show their impact in society has been one of the big issues. And I think over time we are able to generate data that really shows the importance of zoonosis in our society. But that's been one of the primary challenges. The other challenge, as I mentioned, is tied to the first one, because lack of adequate data on some of our One Health issues in our country is a big challenge. Zoonosis, for example, most of them are neglected in nature, so there's limited information about their burden, both in human and animal health. Their economic burden is also a challenge. And so advocacy to policymakers when you do not have data, when you're competing with, for example, tuberculosis and the malaria, where there's tons and tons of information out there, is a bit of a challenge. But on the contrary, I think over time, operational research, really focusing on surveillance of some of these diseases is generating good data. The last challenge I would think of as a main challenge, of course, is coordination of multiple players. One Health involves working with people from different sectors, and so multi-agency coordination is a bit of a challenge. A lot of people don't understand One Health. A lot of people don't understand why data, share data. And so we really have to fight over the fratricidal mentalities, but I guess we're getting there.
Thank you very much, Dr. Martin, for your time. We really appreciate the information that you've given us. Thank you.
Thank you.